Yeah, so another thing that's pretty neat right now is that we're live streaming this with Bret Harte also. So the presentations that we're doing here go over to Bret Harte High School, so they also get the same information you all are doing. So they have students right now in their Performing Arts Center also, but they get a screen and you all get the people here. And so we'll be doing that with Bret Harte throughout the year is since we have people coming to share information, getting that to as many people as possible. So today, I want to thank everyone in advance for being respectful for our two speakers. Of course, they're coming from a very, very busy schedule and giving time out to be here. So thank you for your thoughtfulness. Thank you for showing your CHS pride, your personal responsibility and respect today. It's greatly appreciated. Our two speakers today are both from Dignity Health, Mark Twain Medical Center, and we have Katherine McCoy, who's the Chief Nurse Executive and Vice President of Patient Care Services, as well as Dr. Andrew McCoy, who's a general surgeon. So you all can come on down. So as most of you are probably already aware, this one is about careers in the medical field. And I think what you're going to find today is there's such a wide range of careers that are available in the medical field that yes, you could be a nurse or a doctor, but beyond that, there's hundreds and hundreds of other jobs that are potentially you could be looking into. So with that, I will hand it over to
Thank you. Thank you for having us here today. This is really exciting. This is the second year I've come back to help spread the information about what jobs are available if you choose to come and work in a hospital family. And Dr. McCoy, whose name is McCoy, just like my name is McCoy, but we're not related. We get that question asked quite a bit. Is also Chief of Staff. So I'm going to ask him to talk a little bit about his role as Chief of Staff and what that means in a hospital setting as well. So I'm going to speak first, and Dr. McCoy, if you want to take a seat until you're up, that would be great. And I'm going to ask the lovebirds in the last row over here to come take a seat up close where I can keep a closer eye on you. Because I'm a mother and a grandmother. I want everyone to be up front so they can hear this information. Thank you very much. All right, so we have freshmen, sophomores, juniors, seniors. Anyone in this auditorium, in this room right now who has a goal after high school of still living with mom and dad? Anybody have that goal? So you want to get a job, right? You want to get a job, you want to live on your own, you want to go to college. But one way or the other, you want to make a life for yourself. That's your goal. And so I'm going to help you understand what kinds of opportunities there are in a hospital. A hospital is like a little family. And I say that because it takes many, many different types of folks coming together, different types of jobs coming together to make a hospital work. It's not just about nursing, although I'm a nurse and I'm really proud of it. And I've had a wonderful long career in nursing, and I could talk hours with you about the wonderful different things I've had a chance to do in my career, including working overseas, living in Singapore, working and living in Kuwait. I could talk to you about lots of fun things I've done, building simulation labs, having all kinds of great adventures. But it's not just about nursing. It's not just about the physician piece of it. It's about the people who clean up after our patients. It's about housekeeping. It's about dietary who feed our patients. It's about the maintenance workers who keep everything working in our building and fix things that break continuously. It's about folks in biomed who look at all of our equipment and make sure that everything's calibrated and that all the labs the lab equipment is giving the right results so that we can make the best decisions based on those results. It's about physical therapy and occupational therapy and speech therapy. It's about social workers. It's about all kinds of different positions coming together under the roof called hospital. It's about folks in the clinics who take care of our patients outside of the hospital. It's about the emergency room. It's all of these things. So some of what I brought today to help you to understand what it would take to get into an entry-level position, whether it be your interest in lab, whether it be your interest in nursing or being a cook in our dietary department. I brought job descriptions, and I want you to be able to take whatever you want with you so that you can see what are the requirements to apply for a particular job. It's also important to think in terms of what is your career path when you're making these decisions. For some of you, you may be going off to a four-year college, but I know that not everyone goes off to a four-year college. In fact, only about maybe 12 to 24% of kids graduating today from high school are going off to a four-year college or university. Many of you are going to be taking advantage of the fact that Columbia gives you a first year free, and I think that is a phenomenal opportunity, and I advise you to take advantage of that if you can. Stay closer to home. If you don't know exactly what you want to do, give yourself a little bit of time to figure it out, but don't put it on hold. Get your college credits started as quickly as possible. Because when you find that you take a break, it's easier to take another year off and then another year off. And before you know it, you've postponed it completely. So anyway, if you want to take a view after the presentations, look at some of the job descriptions that I brought with you. It will show you exactly what it would take to get into any job that I brought. And if you have something that you're interested in that I didn't bring today, let me know. I have my business cards available as well. You just text me and let me know how to get that information to you, and I will. But when I say it's important to understand what your path is, I say that because not everyone's going away to a four-year college, like I mentioned. Many of you want to get your foot in the door, and maybe you want to work while you're going to school because you need to help support yourself while you're getting your education. So think in terms of what I call an entry-level position. Maybe you want to be a medical assistant, or maybe you want to be a nursing assistant and get your foot in the door with something that only takes a few weeks of training, and then you want to go to school to be an RN. Or maybe you want to find out, is working in the hospital really for me? Maybe it's the environment I think I want to work in, but I'm really not sure. Maybe I'm not going to be able to stand it. What if I see an emergency? What if I see somebody with, blood and guts and dying and somebody's being coded? It's not like it looks on television, although sometimes it's a little bit more realistic these days than it once was. I can remember the times when they would have a breathing mask on a patient and they were holding it upside down on house, and it used to drive me crazy because I knew that wasn't the real world. But you have to think about what your reality is. So if your reality is that you're going to be supporting yourself and you want to find out what's available in a hospital on a part-time basis, or what we call a per diem basis, which means you just work occasionally to make some money while you're going to school, then think about that. How many in the room are thinking about medicine, either in nursing or physician, physical therapy, something of that nature? Great. And how many are thinking in terms of staying in this county after you graduate and you finish your school? How many are thinking of staying in Calaveras County? Okay, fair enough. Okay. How many are thinking of going to another state? That's a trend. Are you going to another state just for school, or are you going to another state just to get the you-know-what out of California? Huh? Out of California? Going to school out of state? Okay. So for seniors in the room, who already has a college plan? Anybody want to share what their college plan is? How about right up here? Rip curl.
Trying to go to the University of Arizona.
Okay, and your major will be?
Nursing as of now.
Okay. All right. How about you in the back? Excellent, excellent. Anybody else? Fire science. All right. So you've given some thought to this, right? Now, how many of you have someone at home that's really helping guide you through all of this process? Okay. Not everyone does. I certainly didn't. Neither one of my parents graduated from high school. So it wasn't something we sat around the table and talked about in my family. We didn't talk about college. We didn't talk about where to go to school or how to get there. Those were things I had to figure out on my own. And so part of the reason that I give back to the community and come and talk to you guys is because I think it's really important that adults come and share information with you. I would have loved for someone to have come and talked to me. The reason I was excited about nursing was because my grandmother had been a nurse, although I never knew her. She died when my mother was 15. And so I never knew her, but I knew that she loved nursing. The family all talked about how my grandmother Ruth loved nursing. And I couldn't help but think that somewhere, maybe it skipped a generation, but she passed that love for nursing on to me because it was what I always wanted to do. So I will tell you that it's not an easy thing to get through, but it's not impossible either. But it's like anything else. You get started, you make a plan, you adjust your plan, and you keep going, okay? So you don't give up. You don't give up on your plan. So tell me what it is that you think is the biggest stumbling block to getting from where you are right now to finishing college, getting prepared for the future. Is it funding? Is it support? Is it not being clear about how to get there? Out of those three things, how many say it's funding, money? Okay. How many of you have had anyone talk to you about having funds that could be available to you, scholarships, things of that? Do you know what scholarships you can tap into at this point? Have you looked into scholarships? Okay. How many say that it's just not knowing how to get there from point A to point B? Okay. And so I know we have counselors, right? We have counselors in the high school. We have folks that work in our industry that would love to come and talk to you one-on-one as well, depending on what it is that you're interested in. And maybe if you wanted to sit and talk with someone from physical therapy, they could point out to you exactly how they got through the program, how they found their way. If you wanted to talk to someone from dietary, if you wanted to be a dietitian as an example, Michael Helwig could come and talk with you about how he became a dietitian and what classes you have to take. If you wanted to talk to someone who's an occupational therapist, I know exactly who would be able to talk with you. And certainly Dr. McCoy is going to talk to you about what it is to be a medical student and to find your way through medical school. And perhaps when you start medical school, you're not really sure what you want to be as a specialist, or maybe you don't want to specialize at all. Maybe you want to do family practice, but maybe you don't know. And you find your way just like you find your way in nursing. Do you know how many different ways there are to be a nurse? It's what I think is so special about nursing. You can go into nursing, and once you have RN past your name, you can never touch a patient. If you never want to touch a patient, you don't have to. You can sell equipment. You can work for Hillrom, as an example, who makes all of our beds in the hospital system. You could be a salesperson for pharmaceuticals. You could be a salesperson for many of the types of equipment that we use, for surgical supplies. You can be a flight nurse. You can work on a cruise ship and be a nurse on a cruise ship. You can work with CalStar and just be that nurse on the helicopter that's going from one trauma scene to another. You can work in the emergency room. You can work in ICU. You can work in mother baby. You can work in clinics. You can teach. There are so many different things you can do with a nursing degree. So I will tell you that it's something that is an investment in your future, regardless of what it is that you want to be doing. But there are so many different things that make a hospital work. So how many of you have come over to the hospital or used the hospital for care? Through the emergency room? Did we make it better? Did we help? Yeah? What did you notice? Do you want to share about what you noticed? Was it recently? No? Did anyone have a recent experience through the emergency room? Last time I was talking, there was a guy on crutches who had a football injury and had actually had surgery. And I remember him talking about his recent experience. So if there's anybody who could share what a recent experience looked like, it would be helpful for me to know. Anything? Anyone? Come on, the two guys who are giggling over there together. Him, right here. You tell me. Tell me what you remember recently. I'm sorry, can't hear you. Okay. Okay. Did you have to have therapy? You had surgery. Did you have physical therapy after? What hurt worse, the surgery or the therapy? Okay. Okay. All right. Does anyone else have anything else they want to share about a hospital experience? I can't hear. Yes. But were you better? Did we take care of you? So how many of you are freaked out by seeing blood? No? Not your own blood, but somebody else's blood. Okay. Anyone who's interested in maintenance, like, carpentry, plumbing, electricity, those kinds of things. Anyone thinking about that kind of work? Because we have that in the hospital as well. Okay? We have folks that work in our maintenance department who take care of plumbing, they take care of building, they take care of managing our air conditioning and our heating. They make sure everything's working. They do it all. And when we have contract work that needs to be done, when we're building a new clinic, they're very involved in that work as well, even though a lot of that work's outsourced. There are folks on our campus who oversight that construction. So we have lots of different things that go on. So I'm going to turn this over to Dr. McCoy really quickly, and I'm going to let him have a chance to talk to you about his journey as a surgeon. I will tell you that if you ever need anything for general surgery, you're in very good hands. If he has you on the table and he's standing over you all dressed in blue with a mask on, don't be afraid of him. He's very talented. And he is just a real joy to work with and a great guy. So I'm going to let you talk to Dr. McCoy. And remember, he's chief of staff as well. So I want him to talk a little bit about what his role is as chief of staff. So don't let him get away without remembering to tell you about that part, okay?
Well, hello, my name's Andy McCoy, and I've been told to just talk a little about my journey through medicine. So I'm from North Dakota, that's where I was raised, from a small rural community, and I always wanted to do rural medicine. People always ask how I ended up in Calaveras County, and I was always wanted rural medicine. Even through high school, I thought about being a doctor, but I kept my options open. Oh. Went to a public school in there, and also went to public college in Morehead State University, which is a sister city to Fargo, North Dakota, not related to the movie. You guys might be too young for the movie, but after undergrad, then you do medical school. Medical school is 4 years. And in medical school, you get a lot of exposure to different specialties and subspecialties. The first 2 years are usually classwork, and then the last 2 years is when you rotate through different specialties like family practice, internal medicine, OB-GYN, radiology. And it's in those years a lot of people make up their minds and decide what they want to be. And to tell you the honest truth, most people change their mind. I myself changed my mind. I went from I was thinking I wanted to be an OB-GYN to general surgery. And I think most of my classmates did too. So it's important to keep your mind open when you're going through all these fields. Even undergrad, I remember most people who thought they wanted to be doctors ended up going to other specialties, research, nursing, physical therapy. So it's very important to get exposure to different specialties, because sometimes people romanticize different specialties and think only this is going to be this, and then after they get exposure to it, realize that's not what the job actually is. Let's see here. So after medical school, then you apply for residencies. It's another thing called a match. A lot of people don't know about that. You go apply for different spots in internal medicine, surgery, family practice, and then you enter into a computer system, and the places you're looking at training also enter your name into a computer system, and then they match you. So until you get your match letter in March, you don't know if you can be a general surgeon or family practice. It's kind of a big day. You could be living in New York, you could be living in Texas. After that, you do your residency, and that's anywhere from 3 to 7 years. Mine was 5 years. And then residency is fun. They have some limitations now on hours worked. I can't remember what they are. I think it's 100 hours a week now. Yeah, I think you're limited to 100 hours a week, but you do that for about 5 years for general surgery. And then myself, looking at doing rural medicine. So I did another fellowship in advanced laparoscopic and robotic surgery, because I figured that would be what we could do in a rural community doing laparoscopic surgery. And I did a 1-year fellowship and applied for rural institutions such as Calaveras County, and I like the people here. People often say, how is it different from North Dakota? I say, not too much. Basically rural. It's warmer. It is warmer here, but ranchers and farmers, attitudes are kind of the same as North Dakota. And that's my journey as being into medicine. The total after high school is a 15-year journey. So I'm 38 and only been working for 5 years. So late bloomer, I guess. And then, but I really like what I do. It's really great. Medicine is a great field no matter what you go into. People always think myself, but I always say, it takes the nurses, it takes the janitors, it takes everyone there. If the air conditioner goes down, we can't do our surgeries. It's a big deal. And when one part of the puzzle is missing, we can't do our job effectively. And as far as being chief of staff, that means I'm in charge of the quality and assurance of the different doctors and their up to the skills in the hospital. So, and also monitoring dispute between different doctors and physicians and nursing, and making sure everyone plays nicely in the sandbox, I like to call the hospital. guess any questions on the medical as becoming a doctor, or the time?
Anyone interested in being a surgeon in the room?
Okay, a couple. Any questions? I love being a surgeon. It's very nice.
What type of surgery?
Oh, I was gonna ask a question.
Okay.
How do you have time to get married and have kids and have a life on top of all of that?
Oh, okay. So I'm married. So I got married in residency, and it was you have to have a very understanding spouse. So I think some of the adults here know my wife; she's very understanding. But it was tough. There's a lot of time that she was a single mother and parent. My residency program did in North Dakota. Sent me to Orlando for 4 months for our trauma rotation. So that was 4 months that she was by herself. It's mainly it's a very team approach, and even with right now, there's a lot of times I can make events, but we take 2 cars places because I might be called into the hospital. But she understands that, and we've worked through all those issues. So you do find time. But it does become one of your number one commodities is your time. But you learn how to do work-life balance, and I gotta say it's probably become better the last couple decades just being a physician. As I said, there's now limitations on residencies, how long you can work and how many hours you can put in. And different specialties require different time amounts too. There are some general surgeons, now there's surgicalists out there that do more shift work, kind of like the hospitalists now do, in which you'll just do an 8-hour shift, 12-hour shift, and then you go home, and then you have a life there. Also, like can be family practice or internal medicine and work only in the clinics, and those are usually 9 to 5 jobs too. So work-life balance is getting better in the medical field. I wouldn't say it's a negative now. Used to be especially the surgical residencies, used to boast that 100% of people got divorced in their programs. That's no longer a boasting point and now considered negative. So it's changed a lot.
Okay. Oh, I'm sorry. We had a question up here.
Oh, okay.
Do you get paid during your residency?
You do get paid during residency, yes. So after medical school, you do get paid. It's a standard payment. It's paid through Medicare or Medicaid, I think, pays that to the hospitals to train you. It's an OK income. I think right now it's about $35,000 a year or something like that. And it's the same for all specialties. So whether you're doing general surgery or doing psychiatry or internal medicine, for your residency years, they're all paid the same depending on the location or city you're in. It's only after residencies that doctors make a different amount of money. And that was supposed to help limit people from choosing different specialties because potentially they make more money, but it's only during that training time. But you do get paid money. You do get 2 weeks off. So it is kind of you do get paid during residency, yes.
Were you like smart in high school, or like what was your GPA?
What was my GPA? Oh, high school is, especially our 20-year anniversary. I'm trying to think what my GPA was. I did have a high GPA. I mean, I was a 4.0. I wouldn't consider myself too smart, I guess, but it's mainly just paying attention in class. And honestly, sitting on the other side and interviewing process, when people are coming through and getting into residencies and medical school, because I've sat on the admission boards at both those places, good grades are good. So good grades get your foot in the door, to tell you the honest truth. But really sells an applicant is breadth of experience, to tell you the honest truth. So like at my medical school, yeah, there was a lot of people. I double majored in chemistry and biology, but that was probably only half the class. We had people who had a French major and social work majors. They're looking at diversifying the medical career because you don't want everyone to be chemistry, biology. They teach you the important stuff in medical school. But sometimes if everyone has the same line of thinking, then you go down one path, and medicine realizes we need to diversify the people we have in medicine so that we can treat different diseases and have different approaches. I think one of my classmates, French majors, we had history majors. So don't get stuck that you have to have biology, chemistry. It does help because you do need to have those as you're looking at a medical school you're going to. They have a roster of which ones they require, but a lot of them like the experiences, of different specialties.
We have a question from Bret Harte.
Oh.
What is your average shift hours as a surgeon?
Oh, that's hard to say. So Mark Twain is a little different because for a while there I was the only surgeon, so I was on kind of all the time, and now I have a partner. But my typical day, you start around 7:30, and you go to 5. That's usually clinic or doing surgeries. And then if I'm on call, then I'm just available for the ER if they call. Or if I did a surgery on a patient and I round on them in the morning and afternoon to make sure they're doing okay after surgery. So, I don't know, 50 hours a week probably if you add it all together. It's not too bad once you get out of residency. Yeah.
So how does it feel to take part in a surgery?
Well, I like it, and I think right now, if I wish I'd known, I have a physician assistant student with me, but I sent her home. She can explain. She did her first surgery with me yesterday, and she seemed to have interesting in watching the surgery. I picked general surgery initially. Actually, when I started medical school, I thought I was going to be internal medicine, infectious disease, but I kind of like surgery because you can see a problem and you can tell a patient, "Hey, I can fix that," or "I can't," and then that's just my kind of personality. And then you can fix the problem and send them on their way, and that's what I like about surgery. So it feels really good doing the surgery because you're fixing. Someone comes in with appendicitis or a bad gallbladder or a hernia, or they were shot, and then you fix the problem. And then, so I like doing that.
Are there any more questions?
Is there another one there?
Do you experience post-traumatic stress disorder?
I don't think I do, but I think that's one that's really hard to self-judge. But tell you the truth, there are some times I do get, a little, I wouldn't say post-traumatic, like I don't freeze up, but after, sometimes, especially when I was on my trauma rotations or your pediatric NICU, and you have outcomes that aren't the greatest, car crashes and stuff like that. And it doesn't matter what you do, people still sometimes succumb to their injuries, and especially when they're really young, that does take a little toll on you. But that's part of the job. I don't know if that's what they're asking, but I wouldn't say it's PTSD, but it is part of the job. It is a little stressful sometimes.
We have a couple more questions. Okay, let's take this question. Go ahead.
Okay. So out of the 15 years of your medical schooling,
Yeah.
what would you consider the most difficult time that you had?
Oof. Well, honestly, medical school was a lot of. I thought it was fun actually, a lot of learning. I went to University of North Dakota, and they have a cohesive group, and it's really based off of group learning, so that was a lot of fun. Stressful part was the match when you didn't know where you're going to go for the next couple years of your life. Probably intern year was really difficult too because you're technically a doctor. So now the nurses are calling you. I remember my first call still. It was a post-op patient. I don't think it was a post-op patient. They called, the nurse was just calling for some stool softener, and I was like freaking out, like, oh, what am I going to do? And the nurse was like, okay, usually they say you have some stool softener. I'm like, okay, that sounds good. And then you get over that, and then after residency, and then you're doing your first practice, it's a little hair rising too, because you you can still call and you still have some assistance. That's when I came here. There was a surgeon here who kind of helped me out, but you're still making the call, you know, in the middle of case the first couple time. You know what you're doing, but you're still cutting and doing things. And it's like, oh, am I doing the right thing here? And, but I say whenever you make the next step from, you know, starting medical school, starting residency, starting your practice, those are probably the most stressful and learning time.
Okay, next question. Why did you choose general surgery over other surgical specialties?
Well, it's all individual. I actually liked a lot of the residencies. Like I said, initially I wanted to do internal medicine, and then I actually did an internal medicine rotation. I kind of like being more a proceduralist, I guess they call it, doing things and fixing things. Then I thought I'd be OB-GYN. I thought that'd be a good mix between the two worlds of doing some surgeries and doing some outpatient care. Then honestly, I talked to a male OB-GYN, and he said, it's rough being a male OB-GYN because no one wants to go to you because you're the guy, and all you get is, you know, people too busy to see the female OB-GYNs. And so then I switched to surgery. Everyone has different paths. It's hard to say why I mean, that's why I chose it. I like doing that. But a lot of my friends in residencies, they really like psychiatry or family practice. It's kind of how your personality is. Also different work, you know, back to the first question I had, life-work balance. Different specialties have, I wouldn't say better, but different work-life balance, and you have to see what works for you and your family. Some have longer residencies, like mine was, 5 years. Other have 3 years. So,
What is the worst case you've ever had before? Maybe the one 2 weekends ago?
yeah. The worst cases are like the ones I said before. The ones when they come in, traumatic, and doesn't matter what you do, you're, a perforated bowel, someone, shot themselves or was shot by the police, whatever. And you're trying to fix them up, and it doesn't seem like whatever you're doing is working. Those are kind of the rougher cases. Because even though you tried your best, you still didn't. The patient still didn't make it through, but those are probably the roughest ones.
And the last question on the list here on the computer is, how long did it take you to get used to doing surgeries?
Well, like I said, that's why I think our residency for surgery is 5 years. First, you start off as an intern, kind of doing, they kind of call it scut work on the floor, just getting the patients ready, and then you're observing the surgery, and then you kind of start in the next 4 years assisting and then doing more surgery. So in those, 5 years, you kind of get used to doing the surgeries, and it's repetitiveness of doing the surgeries. Spend a lot of time reading, and a lot of times when you're doing the 5 years of surgery, you're not really learning just to do a gallbladder. You're learning how to do surgery. So you're learning the anatomy, how the body flows. So in case something does happen to surgery, anatomy is, different, or you open up, you think it's going to be appendicitis, and it's something completely different. You know how to deal with that situation when you go in. So you're learning how to do surgery, how to suture, what tissue goes together, what planes you need to respect, and and it also helps in the back of my head whenever I do a surgery. I know, if I do this and it doesn't work, I have one or two. I always have I call it a bailout in my back of my head. If this doesn't work or something happens, stapler misfires, what do you do? In my head, I already have a 2 or 3 backup plans of what to do.
Any other questions? Okay, thank you, Dr. McCoy. I thought the question about post-traumatic stress disorder was a really good one, because in medicine, there are many things that affect us as we have our careers. And I will just tell you from a nursing perspective, nurses can and do sometimes have post-traumatic stress disorder. But there are certain types of nursing that would predispose you to that. Emergency room nursing is one of those areas. And the reason I share that with you is because we have more and more difficulty with homeless population of patients, violent population of patients because of drugs, because of not caring for yourself. And at any given time, we can have anywhere between 1 and 3 patients holding in our emergency room on what we call a 5150, which is a police code for endanger to yourself or others. And over the years, if you have somebody who's extremely violent and has mental illness flying at you, trying to attack you, that you need to use restraints on, that you need to use chemical restraints on, you can choose to get out of that particular type of nursing. And we had that happen just recently with a nurse who had worked for 25 years in the emergency room. But the last patient who came through, that was just enough. She got hit in the mouth with handcuffs. She's still in nursing, but she's doing something entirely different now. So post-traumatic stress can happen with psych nurses, it can happen with emergency room nurses, and it can happen in surgery, in an ICU. It can happen in all aspects of nursing as well as medicine. And sometimes what happens is that you use your best talent and your best effort in making everything come together, and something just doesn't go right. And you have to live with those results, okay? So it's the unknowns that usually can get you off target. So I'm going to close with asking if there are any other questions that any of you have, anything you want to know about in particular. And then I'm going to give you an opportunity to come up and look at the job descriptions. And if you have any questions from the job descriptions, we can answer those for you. And I understand that some of you need to catch a bus. That's on the other side of the campus, right? So you've got other things to do. But I want to thank you so much for paying attention. You're a really bright group of kids. I can see that. And I wish you all the best. Take my card. If there is a question you have or you want to come over and shadow and see something close up and personal in the hospital, reach out to me. And I'll put that together for you, okay? So come up and get job descriptions. Thank you.